Healthcare has been at the forefront of this election campaign so far, and among those directly affected, of course, are Ontario nurses, and that's why they have stepped up to make sure their voices are heard in a number of different ways as Election Day draws near. Nancy Halupa is determined to make sure nurses are being seen and heard during the Ontario election campaign by both voters and party leaders.
If he really wanted to praise our profession, he should have just said.
An ER nurse herself, she's been spending time on social media, Twitter, Instagram, even TikTok, raising her voice with concerns over staff shortages, being overworked, and underpaid, a profession that has felt the worst of the COVID pandemic.
I honestly don't think the public knows. Unless they've been a patient or had a loved one as a patient, they know nothing about what's going on.
Much of the messaging from Halupa and others is aimed at Premier Doug Ford for promising to build hospitals when they say staffing is the higher priority. She's overloaded with comments from nurses constantly needed to work extra time while not being fairly compensated.
The staffing, the patient ratios on some units, ICU, is supposed to be 1-to-1. It's called intensive care unit for a reason. There's nurses that are doing doubles and triples. How do you give someone the proper care when you have 3 equally sick patients?
Bill 124, which limits wage increases to less than 1% per year, has been debated at length and has prompted 3 of the other major parties to say it would be repealed if they are elected. The Ontario Nurses Association says it's not just about the lack of money, but warns about possible privatization of healthcare as well.
Do you think your voice is being heard at this point?
The public needs to listen to us because it's about them. It honestly is about them. It's sad because if we go private, or even if there's some private clinics, they're going to steal staff from the public system. And they also use public money.
You need to repeal Bill 124.
Rallies with pink shirts have been held throughout the province. Signs on doors and lawns have gone up on properties where nurses live, saying, if you're canvassing for the PC party, get off my property.
As a nurse, I encourage people to make their own decisions for their own well-being. And I'm not going to tell anybody who to vote for. I know strongly who I don't want to vote for because we've seen what happens.
For City News, I'm Mark McAllister.